Hello, my name's Alicia Torres. This is my first video journal, and here is my answer to the following prompt. Tests are inescapable. They're everywhere. They can range from a series of questions to 300 questions. The purpose is to test our knowledge, our capacities, skills, and intelligence. They may be a bore to some people, but they can help identify any abnormalities in the field of psychology. Measurements can help show how severe the abnormality is and can provide a framework to the treatment. An example of tests and measurements is the MMPI. It can be used in any field of psychology, especially in clinical, counseling, and educational psychology. Now, the MMPI, which is the Minnesota Multiphasic Personality Inventory, is a psychometric test for adult personality. There are several versions of this test, and there are also a version for adolescents. One, for instance, is the MMPI-2, a self-report inventory that contains 568 questions, right around there. It helps to determine if one meets the criteria or has symptoms of a mental disorder. This helps mental health professionals, and these evaluations can be used in child custody disputes, substance abuse programs, educational settings, and even employment screenings. Now, in clinical psychologists use clinical interviews to gather background information about the person they are interviewing, such as family history, medical history, and personal history. This can help clinicians formulate a diagnostic impression. Not only clinicians use clinical interviews, but also social workers and psychiatric nurses. In neuropsychology, a especially important field that studies the relationship between the physical system and behavior. Now, a test that is conducted in this field is an assessment of intellectual function, IQ. IQ tests do not precisely measure intelligence, but instead measure components of intelligence. Now, the most well-known form of IQ test is called the Wechsler Adult Intelligence Scale, 4th edition. This test contains a verbal comprehensive scale, a perpetual reasoning scale, working memory scale, and a processing speed scale. The subtests provide valuable information about someone's cognitive abilities. The IQ test can help determine if one meets the criteria for any brain disorders, such as autism, dyslexia, ADHD, ADD, or neurodegenerative diseases such as Alzheimer's. Lastly, another example is the thematic appreciation test, TAT, a projective test designed to reveal a person's motives and concerns by using ambiguous pictures of people or situations. Now, this can be used in abnormal psychology or even clinical psychology. For example, a therapist can use this to learn more about a person, their feelings, or to assess someone for psychological conditions. Now, an example of a TAT is a Worcestershire ink blot test. It consists of 10 ink blocks printed on 10 cards. Despite its popularity, it has been the center of controversy. It has been difficult for researchers to study the tests and results. Now, it's important to note that one test can't be reliable and valid. For instance, we can't just rely on one test to diagnose someone because it can have faulty faulty settings. Some of our evidence might be off, and it's important for mental health professionals to use various of tests, assessments, and measurements to diagnose or treat a patient. Thank you very much, and that was my answer to this prompt.